Hi, how are you? I'm going to talk to you again about pregnancy and childbirth. And this tip and trend for 2025 is all about birth plans. What's going on with birth plans? I'm old. You can tell that by looking at me. And I gave birth first in 1970 in the United States. We had no choices. We didn't write birth plans. We had no choices. No choices. However, multiple millions of families like myself took Lamaze classes in almost every hospital in the United States. We had demanded that our husbands were with us at birth and have skills so that they could coach us. And Lamaze offered the first childbirth approach, which included skills, breathing, and relaxation. Because they were the first, the skills weren't adjustable, adaptable, or sustainable. But honestly, my generation, multiple millions of us, your grandparents or great grandparents, we felt empowered by births, even though we had all the assessments, monitoring procedures that were standard of that day. And the Bradley method was taught as well. The Bradley method was more focused on people who wanted home births. But it's still the same thing. 100% of pregnant women are going to give birth one way or another. And we all know what kind of birth we want. We want to live. We want to be alive after it, and we want our baby to be alive. We don't want to suffer too much, and we want to recover, both for ourselves and our baby. And those are actually the three global childbirth goals. And that's what we want. But in modern countries, the natural birth movement in the late 1970s was saying that the skills weren't achieving their goals, which was for low risk women to have a natural birth, which was totally undefined, pain free labor, which is, come on, and without medical care, which, what? And so we were stuck with three goals that were really, really unclear. I mean, women can spit a baby out in 3 hours and the baby can be dead, or she can bleed really heavily. That's a natural birth. I work with a lot of older women who pee every time they cough or jump because they had a natural birth, and having a grapefruit come out their vagina damaged their connective tissue. Pain free, that was Grantley Dick Reed, and really that's unrealistic. It doesn't matter if women are afraid of birth or not. What causes pain is that you have to open up this really tight cervix. It's tighter than your rectal muscle, and it has to open up to that big. And yes, that can cause pain. So just willing it away doesn't work. You have to have skills to cope with it. Because if you think, I'm not afraid of birth, and then you find it painful and you lack skills, then you really get unsettled. And recovery, that's still a topic that nobody talks about. We want women to recover well, and that's one of the groups of people that I work with. Now, I and hundreds of fathers and mothers developed all the birthing better skills, and we developed them in the early 70s before there were birth plans. When the natural birth movement started to say, women know what kind of birth they want, they just need to write it down on a plan and then tell the care provider, and the care provider should try to give them the birth that the woman wants. We knew right away we all want to be alive, we don't want to suffer, and we want to recover. But the birth plans were more specific. I'd like music. I'd like more people than just my husband. I'd like dim lights. I'd like people to delay cutting of the cord. There were all sorts of things. Back in the late 70s, birth plans were often like a book, and the medical profession honestly just rolled their eyes about it. And some people wanted home births, but in many, many, many countries, there's always been midwives. It's just in the US that outlawed midwives in the late 1950s. But people were still having home births. But they wanted to have midwives legal in the United States and home births to be an option, particularly with insurance companies. Okay, that's fine. But the fact is, since the late 1970s, everybody's just been making a birth plan. And why is that? It's because the natural birth movement actually dismissed skills. You can hear it when you read the books. Cows and cats aren't taught to birth. Women don't need to. It's instinctive. We've always done it. We know how. We just need to be left alone to discover birth. And no, fathers shouldn't coach. They shouldn't be telling women what to do. Women instinctively know how to birth. We knew back in the 70s, this was actually just BS. Women are going to birth. 100% of pregnant women are going to birth one way or another. It's going to happen to you, whether you like it or not, how it happens, what happens to you and around you. So the three elements of birth story that women tell, everybody tells it, is when this happened. So it's, you hear that. I started drive to the hospital for my cesarean. That's a time frame. Or I woke up in the middle of the night, my bed was wet, and I realized my water bag had broken. It was 3 in the morning. It's a time frame. My baby was born at 10 o'clock in the morning or 10 o'clock at night. It was a time frame. Or my labor went on for days and days and days. It's a time frame. That's the first element of a birth story. You hear women say it all the time. The second element is what they did or didn't do to me. I was given a rough internal at home by my midwife, or my doctor was very gentle when he did an internal with me in the hospital, or I was so angry with my husband at the birth, or he was wonderful. So that's what people did or didn't do. And that's part of that birth plan, isn't it? And the third element is what we experience. I had a nagging back labor that lasted forever, or the pain after the cesarean was worse than having the surgery done. So those are the three elements. But Birthing Better Families had a fourth element. It's what we did and what our partners did with us. We are highly skilled birthing families for all births without exception. Why? Two reasons. One is your baby's birth is important to you. And the second is 100% of pregnant women are going to give birth one way or another. So it's an activity. So you have to learn skills to do that activity. And what's weird about birth is you can't learn skills by practicing the activity beforehand. That's a problem. And not only that, but your subsequent births might be nothing like the one you just had. That's a problem. However, Birthing Better Families sort of wanted skills for every little detail about birth. I had a niggling labor. What could I have done about it? Or my husband reached out to touch me and I yelled at him, and he wants to know what he can do. Or I had terrible thoughts in my mind the whole time labor was occurring. What do I do? Or my baby got stuck, or I pushed for hours, or I wanted to have more skills when I was having a cesarean, or. And so we have all of those skills because what I did was carry them in my mind. And then when we could make mixed media resources, we made them. And the first one was made in 2000, and that was called the Pink Kit. Now we have online courses, and they're all in the link below. Now, please subscribe, because that helps the algorithms to recognize us and let other people know. Because here I am 50 years later, feeling like I have shouted at a wall for 50 years. We need to grow a self-learning, skilled birthing population. Thankfully, there are more skills-based methods now. You want to use skills. This is an activity. And your fourth element of your birth story should be, I didn't like the pain. I hated it. It was just terrible. But those breathing skills really worked for me. My partner was wonderful. They could see and hear when I needed them to help, and they had the skills to help me right away. Or I could continue to use skills, even though people were doing things to me that I didn't find pleasant. Or I accidentally had my baby at home. Wasn't my plan. And those skills really helped me so that I felt confident rather than afraid. So what I want you to know is you want to couple your birth plans with becoming skilled. Now, if you're working with a midwife or a doula, they should learn the skills that you're learning as well. Sure, we'd like you to use Birthing Better skills, but if you use another method, it's the same thing. Help them understand what skills you are going to use. So at your birth, they can use the skills you are learning rather than skills that they might know. Sometimes they have to bring in those skills, but they usually bring in those skills because you lack any. At 24 weeks is the best time to start to prepare your body for birth because your mind's really clear. At 36 weeks, it's got the baby brain. So 24 weeks, You know you're more than halfway through your pregnancy. You can both feel your baby move, and the hormones are beginning to be active. At 32 weeks, begin to do the internal work because, particularly if you're planning a vaginal birth, hold on, ask your partner this: size of a baby's head, grapefruit, not a watermelon, grapefruit. Ask your husband or your partner if this was coming through your penis, would you prepare it? Men aren't fools. Of course they would. The difference is that it's coming inside us. The cervical dilation is inside us. The movement of the baby down through the 3 inches of birth canal is inside us. So we need to prepare our body to let this big object out. The body skills help you create mobility in the bony structure, and do the skills on your partner first. We share the same bodies. We blink, we cough, we can tighten up our rectum. So when you do the skills on them, they know exactly what to do on you because they can feel it. So you're creating space, mobility, and softness inside your body. When you do the internal work, you're preparing 3 inches of soft tissue to open up rather than to be stretched by this big object. And while you're doing that, you learn the breathing, the communication, the touch, the soft skills, so that you can imagine yourself working through moment to moment the activity of birthing your baby. Now, we have an audio that is about a labor, and you can imagine yourself working through that audio as well. If you've had a birth before and these are new skills or different skills, then go back and apply them to your previous births. See how that changes you. Is it hard to apply skills in birth, even if you can't practice beforehand? No, because once it starts, you realize there you are, you're doing that activity, and you can't hold your hand up and say, hey, I'm going to take a break for half an hour. You have to keep doing it, whether you're driving to the hospital, being prepped, waiting in surgery, you're doing the activity. And once again, why is it important to use skills to do this activity? Because it's your baby's birth. And your baby's birth means something to you. And clue number 2, once your baby is born, you need parenting skills. So having birthing skills is part of your bag of skills as a parent. You're helping your baby move down through and out your body, whether it is having a vaginal birth or a cesarean. It's important. So grow a self-learning skilled birthing population with your partner. Don't follow the order of the birthing better skills on the linear learning management system. Pick the ones you want and learn those first, and have your partner pick the ones they want and learn those first, and then teach each other, and then go on to the next. What is answering your questions about your coming birth? So it can be very simple. How do you work through pain? How do you really relax? We have the answers to that, not because I'm the most brilliant box in the room, but because hundreds of fathers and mothers like yourself developed these skills over a 15-year period, and they asked me to carry it forward to you. And I'm doing that. And I am asking you to carry it forward to others. Okay, so make a birth plan about what you want and you don't want, and learn skills. And if you want to make a skills-based birth plan, that can become your cheat sheet that you take with you or have with you at home. I can't tell you how birth changed from becoming skilled, because we knew from Lamaze that people who were skilled, even using really inadequate skills, had some skill. They gained so much from having some skill. and being able to work together as a family. But when we refined the skills, when we developed an extensive range of skills, our experience of our birth was really astounding because it was moment to moment. We worked through the activity moment to moment. If you labor, why is it called labor? Because it's hard work. That means having skills to do hard work is better than not. So jump on board and remember, like our channel and subscribe to it and pass it on to others. Birth is never going to stop happening. And now is the time for us to grow a self-learning, skilled birthing population for all births. So talk to you again. Bye-bye.